The need for doctors is acute in every part of the province right now. That's not new for Northern Ontario. Some communities there have begun to recruit a new cohort to help out. Our Northwestern Ontario Hub journalist Jon Thompson joins us from Thunder Bay to explain. Welcome to the show.
Thanks for having me, Jan.
All right, Jon, before we dig into your latest piece for TVO.org, I want to take a step back. Can you give us a little update on the COVID-19 cases in Northwestern Ontario?
Northwestern Ontario is divided into two sections, basically Thunder Bay and eastward and west of Thunder Bay. So in the Thunder Bay district, we're looking at 21 cases right now. That population is about 150,000 people. So very small relative to other areas. And in the northwest, which would be again west of Thunder Bay, we're looking at only seven. Some of those to point out is there are active cases now in the Thunder Bay Hospital, and it has made national news for several days in a row that Yamatung First Nation, also known as Fort Hope, has a case, and that's the only one we know of in a remote First Nation.
I understand we also have some developing news in Canora and in Sioux Lookout. Can you fill us in on that?
The Canora District Services Board and the City of Canora are arranging to move impacted homeless and underhoused individuals who may be concerned or suspected of having COVID-19 into a local hockey rink. The work is underway as we speak in order to have small 10 by 10, 12 by 12 wooden spaces made for those individuals. And yeah, they're going to be living at the Keewatin Memorial Arena. In Sioux Lookout, things are going to be a little bit tighter. The current shelter is going to be used as an emergency space, and the community center is going to be converted into the homeless shelter. Dryden doesn't have space like that. So it's doing as Timmins is doing, and a number of other communities in the Northeast, taking out hotel rooms. And that was big news in Toronto as well. But in most of Northwestern Ontario, where are you looking at repurposing other public space?
I want to look at personal protective equipment, also known as PPE, and ventilators. It's obviously been a hot topic across the province in terms of shortages. How is the region doing for those pieces of equipment?
The region, the physicians and administrators I speak to in the region are certainly lobbying as hard as they can. When we talk about the Menoyawin Hospital in Sioux Lookout, this is a gravitational point for 33 remote First Nations, and in a town of 5,000 people. So in good times, perhaps two ventilators might have been enough. But there is concern out of that community that two may not be enough should the coronavirus make its way into those remote communities. There is definitely a feeling there that they're holding it back as well as possible. But people are wanting to be prepared. In Thunder Bay, we're looking at no more than 25. Across the region, there are less than 50. So we have heard federal announcements that there is more in the works in terms of manufacturing, and certainly Northwestern Ontario is doing its share of lobbying to ensure it gets a piece of that.
Jon, we know that resources are low at the best of times. How has planning for the pandemic and now seeing cases been affected by that?
Yeah, there are a couple things that are interesting. For our viewers who are from elsewhere in the province, there is a lesser level of healthcare resources in Northern Ontario as a matter of practice. That's a constant affair. And so the Menoyawin Hospital I mentioned a moment ago, the Thunder Bay Regional, these hospitals are routinely running over capacity and surge capacity. An interesting thing that happened right when large swaths of the public started sequestering themselves was that those numbers actually went down. The hospitals had space all of a sudden where they didn't before. And they stopped doing elective surgery, which in a small hospital frees up a little bit of space. Um, Basically, the smaller your hospital is and the more remote it is, the more it relies on what we call locums, which are doctors who are the hired guns, essentially coming in and doing a shift here or there. And there was a major concern about that. I'm hearing specifically out of Canora and Sioux that they're making longer term arrangements with those locums now in order to make sure that people are here on a longer term basis, because it just doesn't make sense to be flying into a community and only spending a short period of time there. According to the CPSO, Northwestern Ontario needs about 98 physicians, including specialists, and that would be in good times. In Northeastern Ontario, that number would be about 45, and that's family physicians only. That's not including those specialists. And so you can imagine it isn't hitting hard here yet, but should that happen, those resources would not be enough. And that's what brought us to our story on tvo.org about what's being done.
Well, let's talk about that. So the College of Physicians and Surgeons of Ontario has recognized a need. Let's talk about the solution that they're bringing forth.
The rural medicine community was lobbying very hard over the course of the last couple of weeks in order to do a number of different things, and the CPSO has adopted a few of them of consequence. One of them is there's a test that you write when you finish medical school, or two tests really, and those have been canceled this year. And so there was a sense of whether those doctors would just be let into the field or not to be able to work. The college has decided that they will allow for that. And so when we look at that 98 number in the Northwest, that 45 number in the Northeast, we are looking at adding a potential 35. So we know exactly how much we can stretch what's available in terms of our local physician numbers. And the doctors I talk to say that those are going to be very, very well, especially in the smaller hospitals.
Now, I'm curious to know, particularly in these smaller communities, how do the patients feel about these students treating them? I understand that they still will be supervised, but we talk about these are small communities. Doctors are well ingrained inside these communities. They're practically your neighbors.
Yeah, well, the Northern Ontario School of Medicine is unique by medical school standards. One of the things, it has two campuses, Thunder Bay and Sudbury, and it trains its students specifically to work in a climate of Northern medicine. And so what that means is you're looking at an increased understanding or consciousness of working with Indigenous populations and the specific health needs that they have, of Francophone populations, working as a generalist in a small hospital, and knowing the resources that are available to do that. Most of those people, by structure of their application process, are actually from Northern Ontario. So the probability of you running into somebody that you know in your small community who's now a new doctor is a real thing. It's not a certainty, because people do move around. I talked to a doctor in Timmins, for example, who is from New Liskeard. And she was not missing a beat as she's looking to now open her family practice, move into doing emergency routine, and this won't slow those down at all. In terms of those younger students who are in school, they're also participating, doing everything that they can. They're making mock protective equipment for testing to ensure that no tests go unfinished. They're lobbying very hard to start participating with the health units in what we're calling tracing, where we call people and try to determine who might have been in public with people who have tested positive. So those students are out pounding the pavement, doing the best they can to do their part and make sure that Northwestern Ontario is as well served as possible, because medicine is a calling for those people.
Now, I want to talk a little bit more about those students. Obviously, you've talked to many more for this story on tvo.org. Can you give us an idea of how they're feeling overall?
Again, this is why they got into this. So for the people who are new practicing doctors, their confidence is as good as it can be any other year. Remember, this is just the final test that they didn't write. Everything else is as normal. And as far as the other students go, they're doing their best. I am hearing some concerns from established health professionals, and some of those have been published regarding protective equipment and regarding just the health and safety that they have on the front line. But the enthusiasm of the young people and new doctors to do this can't be understated. They recognize that this could be the most important thing that happens in their careers, and by and large, and everyone I've talked to certainly is snapping up the opportunity. Now, in terms of what they are qualified to do, or what senior staff feels qualified to do, they need to sign on with established doctors, and sorry, hospitals. And so there may be some limitations within those structures as to whether they can do, when you're working alone in a remote community, for example. That may or may not be possible in every case. But again, they're doing everything they can to hold that back. I even hear today that the mayor of Canora has been lobbying to try to shut down the Manitoba border. So we're doing everything that we can to ensure that that's not necessary, and that those people are able to work within their skill sets.
Jon, it's always a pleasure to have you on this show. Of course, bringing very important stories from Northwestern Ontario. That's Jon Thompson, our Northwestern Ontario Hub journalist. Thank you again, sir.
Thanks again, Jan. See you soon.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.